For more on the state of vaccines here in the U.S. and globally, we're joined by Dr. Alok Patel, a physician at Stanford Children's Hospital. Dr. Patel, always a pleasure. Great to see you. Thanks for taking time.
You know, Sean, I wish we were talking about something else, but this is an incredibly important topic, a lot of confusion, so I appreciate the moment to chat it through.
Well, just pick up there. There has been this confusion about what the Trump administration, CDC, has done regarding Hep B vaccines. Can you break it down? How did they even reach this decision?
I wish I had a clear answer for you about how they reached this decision. There wasn't any science or evidence laid down for why they wanted to go against the recommendations that have been in place since 1991. Recommendations, I might add, that dropped annual cases of childhood hepatitis B by 99%. So what they basically said was that if you test negative for hepatitis B, for pregnant women test negative, you may or may not actually need to get that birth dose. They removed that recommendation and instead left it to a model of shared decision making. But they did recommend it still for people who have unknown status or people who are positive for hepatitis B. Now, where the confusion lies is the fact that in some situations, yes, a child may be protected against hepatitis B, but there are a lot of cracks those children can fall through. We don't have equitable access to care in the United States. Somebody can test negative and still get it later, or there can be a false negative. But also, hepatitis B is so incredibly contagious that a baby could go home and a caregiver, a friend, a sibling, anyone with just a microscopic amount of blood could pass that infection on to an unprotected baby, which in children, there's a 90% chance of a chronic infection. So all the confusion we worry might lead to more cases.
That's heartbreaking. I want to talk about misinformation, and including coming from the health secretary, not including, basically coming from the health secretary. So what is the impact on American families?
The impact is people start wondering, where is this information coming from? Where is the confusion coming from? That then leads to vaccine hesitancy. That leads to more illness. We are already seeing an unfortunately large amount of measles cases, both domestically and globally. We're also seeing rising cases of whooping cough. We're seeing a less than ideal number of influenza vaccinations. And now we worry there might be more hesitancy towards hepatitis B. People want to know where they can go and turn to for reliable health information, and that's now being a question about whether or not they can actually turn to the CDC or HHS. So at the end of the day, if you have questions, please talk to a healthcare professional, talk to your doctor. If you don't have access to a doctor, talk to anyone who you know will give you credible, evidence-based information.
Yeah, so doctors are clearly going to give you evidence-based, but what about U.S. states? How are they responding? And the pharmaceutical industry, because they're pragmatic, if nothing else.
You know, we mentioned at the top of the story that there is some pushback against the medical industry, and I want to be clear, there are over 40 national medical organizations who have gone out and issued a joint statement essentially condemning and criticizing this decision by ACIP. That's the CDC's advisory committee for immunization practices. So long story short, most health agencies in states and national health organizations are still recommending the universal hepatitis B dose at birth, including the pharmaceutical organization as well. And I want to be clear that people can still have access to this shot. Even if you test negative for hepatitis B, you still have access. That's not the question. And it should still be covered by insurance. But what we're seeing right now is a lot of misinformation and confusion, which is then going to fall back to OB-GYNs, pediatricians, and doctors to set the record straight.
You know, there's no easy way to ask this, but how much damage is the health secretary doing to the United States, especially if you look at the way it aligns with other nations around the world and their vaccine guidance?
It's truly hard to quantify, but aside from what's happening with vaccine misinformation, with nutrition misinformation, and the defunding of research, NIH research, mRNA vaccine technology, I've heard estimates from scientists saying that this is going to push us back almost a decade. And I'm very cautious. And I almost worry when the United States gets compared to other countries, because the fact of the matter is some other countries, such as high-income European nations, have universal access to health care. They don't have maternity care deserts. They have access to nutritious food. They have more screening. We don't have these luxuries in this country from state to state, Sean. We have 35% of U.S. counties are maternity care deserts. Not everyone has access to a pediatrician. And so vaccine policy has to also take into account what healthcare and equity looks like in that country, and we currently are not doing that.
You know, I think the last time we talked, we were talking about vaccines, and in fact, there are some vaccine deserts in the United States. Some counties the kids simply aren't getting vaccine. In other areas, it's 95%, that kind of thing. I want to get your thoughts on the experts warning against trusting the CDC, because the CDC has always been our true north, the one entity that we could look to, the one entity we could count upon. But that's not the case anymore.
It currently isn't. So people have historically been able to trust the CDC, but also ACIP. That committee's been around since the 60s, and they have been the go-to for vaccine policy. And oftentimes, health agencies follow ACIP's guidance for what to do when it comes to the childhood vaccine schedule. And so, like I mentioned, we are seeing a rising rate of vaccine hesitancy. We're seeing more children enter kindergarten without the recommended set of vaccines. And oftentimes, we worry about those who are most vulnerable, not the children who come from a higher resource background, who have access to medical care. I worry about a lot of children who may not be able to go into an urgent care or go into a pediatrician. And we're in a place now where you're seeing measles cases almost become a normal headline, and people forgetting how incredibly dangerous and contagious measles really is, one of the most contagious viruses the world has ever known. You know, vaccines have been so incredibly successful over the past 60 years that people no longer fear the diseases that they are preventing. They see misinformation about the polio vaccine, but have completely forgot, or it's completely foreign to them, about the detrimental effects that polio once caused, that polio once used to paralyze children. So we are in a place where we have to remind people why we're doing what we're doing to protect not only you and your families, but the community around you.